Many people find the interaction between doctors a deterrent to seeking medical attention. Many people, like myself, struggle with social anxiety, with the numbers being 1 in 3 globally. Additionally, iatrophobia, also known as the fear of doctors, occurs in 12% of American adults and 19% of American adolescents. This causes 1 in 3 Americans to avoid going to the doctor, even when they have reasonable suspicion for being sick. Additionally, the average cost of seeking primary care is $148 an appointment with insurance. And also, doctors work upwards of 50 hours weekly. So this is where BillyBob begins. In order to aid individuals with social anxiety and iatrophobia, we developed a system in which individuals are able to seek basic medical attention without the hassle of seeking a physical doctor. Design. So what exactly is BillyBob? He's an AI-powered robotic doctor stationed at pharmacies, which can administer like a basic physical exam to determine common or minor illnesses like the cold or flu. So this allows patient to seek an easy way of medical attention without having to go through the whole appointment process through a clinic or a hospital. So how he works? He works through a machine learning database, which is trained to identify the correlation of sets of symptoms to the illnesses. This machine learning database is trained by having a doctor diagnose patient, list their symptoms in detail, and then their final diagnosis, which is added to the database. Several trials are repeated in order to train this database to be accurate. So this is the design. He's designed to look approachable for people of all ages to be able to feel comfortable having medical attention from someone that's not a physical person. So there's a chat display on the left that will display the chat logs, allowing the patient to interact with him. The right panel is for entering medical details, so he can access medical history and contextualize symptoms. And the bottom compartment is for accessing the prescribed medicine once diagnosis is determined. So the average interaction is a patient will go to one of the locations that he's stationed and will enter medical ID, allowing them to access medical history, and he'll begin prompting the patient with questions that will narrow down a diagnosis. So if the diagnosis is narrowed down and determined, he will prescribe the appropriate medicine to combat the illness. However, if symptoms lead to problematic diagnosis, he will then refer the patient to an actual doctor or clinic to have further research done.
Please go to I slept in my room. It's so plain. Emma sent me a picture of her room, and it's so pretty. Like it's so
Can I ask
aesthetic.
Alina Lee?
Everything looks exactly how it would in like a perfect background. It's like she has like the
Can
fluffiest
Alina Lee
stuff. It
make
looks
me
like
some?
a please? I was so jealous.
It takes time to figure
Her
that.
parents, she doesn't.
Alina Lee?
Temporarily mute. Oh, okay.
All right. I paused the timer, so you can keep going without worries.
Okay, so as you can see here, first, in a diagnosis, Dr. BillyBob will ask the patient for the symptoms that they are currently experiencing. And then, based on the patient's answer, Dr. BillyBob will ask a follow-up question in order to narrow down the list of possible ailments. And then once he has completed the patient's diagnosis, Dr. BillyBob will inform the patient and provide recommendations for possible treatments. But if Dr. BillyBob determines that the patient is afflicted with a life-threatening illness, he will refer the case back to medical professionals. We plan to first implement our AI doctor in pharmacies first for easy access to over-the-counter medication. And then depending on a positive or negative customer response, we plan to link our robot with hospitals and insurance companies so severe cases can easily be referred. Thanks for listening to our presentation.